I got it like take a bore of sun with no sunglasses on.
Yeah.
What's a sun Oregon like? Right. So. Is everybody here? We got everybody here? Okay, great. Well, welcome everyone. Glad to be here. I'm gonna let you. It's your shop.
Great. Well, welcome everyone. Really appreciate you being here at Mosaic, and it's an honor to host the governor for this panel. It's a really important time for us to be having these conversations. So I really deeply appreciate you. Some of you have been far away to come be with us, but this is an important time for us to be together. So what I want to do first is just go around and do brief introductions, and then we'll go into our program. So if you'd like to kick us off, that'd be great.
Jenny Quitter. I am a mom, I'm a caregiver, and I'm a peer support specialist for Treehouse Therapies.
And please tell me where you live if you're.
I don't want to say where I live. I live like 10 minutes up the
Oh,
street.
Wisconsin.
Well, hello, my name is Kelly Frank. I wear many hats. I'll get into them a little bit, but I am the food systems coordinator for a local nonprofit in Burns, the High Desert Partnership. So, Harney County, thank you.
My name is Andrea Carr, and I'm here with my amazing artistic daughter, Alicia. I am first and foremost a mother, and I relish that role. And I also have the incredible opportunity to provide care for my daughter because of Medicaid dollars. So I appreciate being allowed to sit at this table to share a story. The best way. Thank you.
And hello, everyone. I'm Olivia Quiroz. I'm the Executive Director for the Oregon Latino Health Coalition. We're located in Southwest Portland, so I did drive out down here, but I grew up in the Dalles, so familiar with rural Oregon. We are a nonprofit. We do statewide coalition work, and we were one of the leading agencies to pass Healthy Oregon in 2021.
It's
Logan Clausen. I'm a pediatrician and the CEO at Central Oregon Pediatric Associates, a group of 4 clinics that's independently owned, pediatrics only. Here in Bend, sorry.
I'm Janelle Lewis. I live in Madras, so just an hour north of here, and I practice rural family medicine there, do inpatient work, OB care, pediatric care. And then I work half-time for OHSU right now as a program director for a new rural track residency program. So I do a lot of teaching of medical students and then residents coming up here and have 4 kids. So.
I'm Linda Selby. I am a mom too, and a practicing family medicine physician in the frontier town of Burns after 21 years in Prineville. And I'm also the CMO for the hospital.
Next.
My name is Jeremy Davis. I'm the president and CEO for Grand Island Hospital in LeGrand, Oregon. Been there for 6.5 years, and I'm a native Eastern Oregonian from Baker City. So came back home.
Afternoon, I'm Sean Jessup. I'm the CEO of the Eastern Oregon Coordinated Care Organization. I came up from Portland at the health office, but in Eastern Oregon quite a bit. And we serve about 80,000 Medicaid lives through the Eastern Oregon CCO. So a combination of Oregon Health Plan, Bridge Plan, Healthy Oregon Program populations. And we cover 12 rural and frontier counties. So when you think of frontier, that means about 1 person meaning 6 or fewer people per square miles, excuse me. So we are truly providing care in most rural and frontier parts of the state.
Thank you for being with us.
Absolutely. See you as well.
I realized you forgot to say my name. So, so Megan, I'm a family nurse practitioner and CEO for Mosaic Community Health. Again, thank you all. So what we'd like to do is kick it off first with Governor Kotek saying a few remarks.
Well, again, good afternoon, everyone. And again, thanks to everyone here at Mosaic Health for hosting us. Again, really appreciate it. Even though you might not live in rural parts of the state, you're serving folks and working with folks around the state. So I really appreciate that. 12 rural and frontier for the CCO. So thank you for taking the time to be here, travel, in some cases long distances, really appreciate it. We're in an interesting time as it relates to the success that we have built in our state as it relates to taking care of, our neighbors and some of our most vulnerable individuals. And I'm really looking forward to the conversation today to hear from you directly about what some of these reductions that are being contemplated in Washington, D.C. will do to folks here in the state, because I think it's really important to hear that. I can help you elevate that, and we need to continue to educate folks about what is going on here. As you all know, Medicaid in the state is the Oregon Health Plan. Serves more than 1 million Oregonians across the state, and in rural parts of the state, absolutely essential for not only providing healthcare, as you know, but also keeping our healthcare providers there, right? Making sure that the hospitals, the clinics, and the providers can actually be in these communities. One of the things that we know from what we're hearing from Washington, D.C. is that the proposed cuts when it comes to Medicaid could really hit our rural communities the hardest. We're here in Bend today. For those of you who don't follow the congressional lines here, this represents 2 congressional districts, 2 and 5. Congresswoman Janelle Bynum, Congressman Beth Pence are the congresspeople from here. 1 in 4 people in this region rely on the SNAP program, which is our food assistance program. It's a state and federal partnership, as you know, and it is something that without federal help, we cannot provide that food assistance at the local level. In fact, Congressional District 2 has the highest reliance on benefits from the SNAP program in the state. So we know that while there might not be a lot of people per mile, they are counting on these benefits. So as we know, last week, last few weeks, Congress has been working on a piece of legislation that would significantly cut programs in Medicaid and Supplemental Nutrition Assistance Program, the SNAP program, primarily to find money to fund other things, in this case, tax breaks for really wealthy individuals. That is literally what is happening in DC right now. And when it comes to the SNAP program, I think lots of you know that I got my work I started in the state working on food, anti-hunger work. And the SNAP program in particular serves, 750,000 plus Oregonians to help put food on the table. The cuts that we're looking at right now from Congress would require states to pick up a portion of the benefit and increase our administrative costs to do a very complex program. Let's remember, we have people who work hard to be eligible for those programs, and what Congress would be doing is cutting that in that bill. When it comes to health insurance, I want to thank all of you. We have worked really hard in this state to make sure people have access to healthcare. And the first step on that, it's not the only step, but one of those steps is making sure people have health insurance. That's through the Oregon Health Plan. And 97% of Oregonians have that coverage. That in jeopardy with what Congress is talking about. 1 in 3 Oregonians rely on Medicaid. Half of all of our births in the state are covered through the Oregon Health Plan. And 2 out of every 3 nursing home residents rely on Medicaid, the Oregon Health Plan, for funding stream. And we also know we're talking lower income Oregonians. These are not high income thresholds. So any change in coverage, whether it's SNAP or health insurance, will have significant effect right away for families in the state. So for me, I want to make sure people stay insured, they have the money to put food on the table. And so what I'm hoping to hear today is just tell me what it's like from what you're doing on the ground today, or whether you're a recipient, and say, like, this is what this means for me. If these things are cut, this is how it's going to impact me and my community. And frankly, what I'm trying to do is make sure we have all the information possible to raise our voices, to tell Congress this is the wrong thing to do. So really appreciate all the time and effort today. And with that, I'm going to hand it back to our moderator.
So I'm going to kick us off with a few remarks. And Governor, I really appreciate you calling attention to the really important critical work over the last 10, 15 years to get to that 97% number. That is incredible, because the impact of that for our communities and families is so significant. So I'm deeply concerned about the potential impacts that these proposed cuts to Medicaid would have on our patients in our community. At Mosaic, more than 34,000 of our 34,000 patients, over half rely on Medicaid coverage. This coverage allows our community members to receive essential healthcare services and preventative care that helps keep them engaged and contributing to the community, whether that's through work, education, or providing caregiving for their families. Without this coverage, Medicaid will be, many people will be forced to avoid or delay seeking help for their healthcare needs, resulting in declining health and eventual healthcare crises that leads them to going into the hospital and poor health outcomes. And this actually costs taxpayers more money in the long term. With the proposed cuts, community health centers like Mosaic and hospitals that serve rural communities are in danger of either reducing services or actually closing, forcing people to travel large distances for their care, and also impacting our local economy and eliminating critical jobs. Medicaid cuts would take us farther, not closer, to our collective goal of a healthier community. So what I'd like to do next is go ahead and pass it over to share.
A different direction than yours.
The richness of the.
I know. Didn't think of it. My daughter wanted me to bring this. This is, here she is, so. I do, she wanted me to. Did I? Yes. Again, Jenny Witter, mom, personal support worker, work for Tree Health Therapies as a peer support specialist. I'm just gonna kind of go over my notes because I don't want to forget anything. So in a nutshell, so 2 years ago, I lost my mom. Her name was Lori. She spent 43 years caring full-time for my brother, who was medically fragile, nonverbal. He experienced life-threatening seizures, needed 24-hour care. He weighed 300 pounds in his adult years, and my mighty little mom, 115 pounds. Despite her tiny stature, she lovingly bathed, diapered, cared for John every single day of his life. So that's kind of where my story begins. She did it all, no breaks, no help, no rest, no real support system in place. She kept him alive through sheer love and unimaginable strength, truly unimaginable strength. She chose to keep John at home, in part just because his care would be better in the loving care of home. So thanks in a huge part to Medicaid. So, but it did end up costing my mom everything. She did lose her life. So I'll get into that. When John became bedridden, Medicaid stepped in and made it possible for him to be at a rehab facility here in Bend. John, my brother, died 3 years ago. And then my mom died a year after. I truly believe her life ended prematurely due to grief, exhaustion, and a system that asked too much and gave too little for her. My mom and John both absolutely deserved better. So now I'm walking the same path. I have a daughter with disabilities. I am her main caregiver, and she lives with multiple disabilities. Every day I see my mom's face when I look in the mirror. I see myself as tired, anxious, and drained. I carry the same fears that my mom did. Will my child be okay? What will happen if something happens to me? Can I survive this? Can she survive this? How am I going to do this without more help as we keep going? Medicaid is truly what keeps us going. It's not just a program, it's a lifeline. It gives my daughter the therapy she needs. It gives her a support worker that gets her out into the community. And it helps her remain home where she is safe and she's deeply loved. It provides her desperately needed medical care and huge mental health support, because some of these kids that have disabilities and they understand it, they need that desperately. So without Medicaid, our world truly falls apart, period. And I know I'm not alone in this feeling. In the treehouse side, I'm a peer support specialist. I stand alongside families and support parents who are taking care of medically fragile children. And I see this truth when I work with these families and hear their stories. They are literally drowning. They're drowning in stress. Medicaid and SNAP are their only lifeline. Sometimes it is keeping their heads above water. If this is taken away, it is truly pulling the last thread of their lives. It's holding them together. Cutting Medicaid doesn't just slash a budget, it will destroy some of these lives. If we allow these cuts to happen, thousands of families, just like mine, will be left with nowhere to turn. Parents will be forced to quit jobs, lose their homes, and some of these people could potentially be out on the street with their disabled children, abandoned by a system that promised to protect them. This is terrifying, and it's a reality that we're facing. We're doing everything we can. We love our children, we care for them, we fight for them, but we can't do it alone, and we shouldn't have to do it alone. So that's where I'm at. He's down with us. So But stand with us, fight for us. And that's my story.
Jenny, I really appreciate the lifeline comment because that's the truth about this.
It is.
Even saying safety net doesn't really capture the essence of the lifeline for both of these programs.
Right.
And your story is really powerful and it reflects that. Deeply.
Well, and I've come full circle. I've seen how this ends. I mean, I truly have. My mom is gone and she was just broken. So yeah. Thank you.
Thank you for sharing.
Thank you. And I'm glad I held it together.
We all are.
I'm gonna hold my questions till the end because I'm not there.
Thank you, Jenny. As a mom, that was, powerful to share. So I mentioned, my name is Kelly Frank and I have several roles. I'm on the Oregon Hunger Task Force. I'm the food systems coordinator for the nonprofit High Desert Partnership. I run the Burns Farmers Market and I'm also a local grower, very small scale as well. Finding ways to provide fresh, healthy, and local food into our community is absolutely my passion. Harney County is considered a food desert. It's extremely remote to anyone who's been there. We are actually outnumbered by cattle. I think it's 12 to 1. I feel like that puts things in perspective a little bit. We are located over 125 miles away from the next closest town, and we also have an extremely short growing season. So it's very difficult to grow food there and to find food at a reasonable cost in our area. Harney County has approximately 15.2% poverty rate, and we have an aging population. Our community is struggling to make ends meet, and the increasing prices of groceries is really hard on everyone. One of the tasks I get to do as the food systems coordinator is provide local CSA boxes to the food hub. We put together eggs, meat, locally grown, and we deliver that every week during the summers to our food bank. I was actually there this morning prior to driving here. So I got to have some real conversations with people in the food line as well as a representative from the food hub. And she mentioned to me the amount of families and the people in the lines has increased significantly from last year. For example, in December, there were around 93 households with 212 people. By May, that number has jumped to 171 households with 355 people. On top of that, there's very few places to get meals and the food deliveries, as well as Oregon Food Bank has been having cuts. So we used to get food coming from Malheur County and other places in Oregon Food Bank. So now our numbers are increasing and there's less food available because they're not able to send as much. The Harney Hub recently received a refrigerated truck. There was a grant, I said recently, but it's been probably about a year and a half, refrigerated truck to make deliveries to the very remote places in Harney County. So not just Burns, but Druzy, some of the other areas. I looked at it this morning. That truck has right around 2,000 miles and it's been there for close to 2 years. And most places in Harney County are hundreds of miles to get to one way. They haven't been able to take it out and do the deliveries in those remote areas because they don't even have enough to meet the food needs for the people standing in line at the hub, let alone go out and do those deliveries. I can't imagine how difficult it would be to have to make cuts and decisions, but I do feel if SNAP benefits are cut, there'll be a lot of hungry people with extremely limited options in finding ways to feed themselves and their families.
Kelly, it also highlights that we're already in crisis. Like we don't have enough to meet the need. And we know that food is so critical to the health and well-being. But thank you for your passion in this area too.
Yeah, one lady shared today that she gets $23 a month for SNAP. And as a mom and having a family, I don't know what you do with $23. So I think cutting that kind of put things in perspective as well. Yeah, thank you.
Andrea.
Oh, hi. Governor Kotek, thank you so very much for this opportunity. And I feel like this is now, if we can have an impact, that would be great. So I appreciate everybody showing up today. So Governor Kotek, thank you for the opportunity to be a part of this extremely important conversation. My name is Andrea Carr. I am a mother and I'm a personal support worker, and I hail from Spray River. My adult daughter, Anisha, has autism and very complex medical needs. The Oregon Health Plan covers her care and also pays me to care for her in our home. SNAP helps provide her with food. Together, these programs make it possible for Anisha to live safely and with dignity in our community. A few months ago, in March, Oregon implemented a new needs assessment guideline that resulted in Anisha's care hours being cut. To be clear, she still needs round-the-clock 24-hour care, and I'm still the only one providing it. But the compensated hours were cut to less than half of what they were. Half, huge cut. This unexpected financial burden on my family has been harder and harder to shoulder every month. Any cuts to Medicaid or SNAP would make it impossible for me to provide the basic needs for Anisha and my family. Sadly, we are not alone. So many of my neighbors in my little town live in poverty. There are no jobs and families are struggling to keep food on the table. Meanwhile, our rural healthcare system is so frayed that every step of Anisha's care takes careful planning, travel, and time that we can barely afford. 100 miles round trip for routine care, 250 to 300 plus miles for specialty care. These cuts would make it worse. More clinic closures, longer wait times, fewer providers. Her health relies on continuity of care. We risk having no care at all. Medicaid is truly the patch that is holding our broken system together for everyone. If it is torn away, the system will fall apart for everyone too. Clinics and hospitals will close, the same clinics and hospitals we all rely upon. Medicaid and SNAP are also the lifeline that I'm counting on to keep my family stable while I strive to bring us greater security. Cry. Okay, that's my I recently applied, to Southern New Hampshire University. And last Friday I was accepted. Thank you. I will finish my bachelor's degree in political science, and I will add a certification in undergraduate social justice from Harvard. As my bubby used to say, and I'll say this in English and not Yiddish, you can get pissed or you can get off your can and change things. She was always right. Oregon has worked too hard to expand access, the 97% that we all share in healthcare, to get people covered. We need to build on that success, not let it be torn away. So I want to know, what can we all do as Oregonians to protect our families and our communities? And thank you for this opportunity.
Thank you.
Well, congratulations. Thank you. I mean, at 60, what are you going to do? Make bread? Keep going. That's right. I still have breath. I can do this. Well, I love the life with dignity. And that's what we all want. Yes. Good. It needs to continue, like you said. Well, and we need to make it relatable. I think some folks are missing out on the human face of everything and the struggles that we're all, representing and fighting against. So, thank you.
So first, I want to thank your staff and your leadership for joining us together today in this critical moment of our state's health. Again, I'm Olivia Quiroz. I'm the Executive Director for the Oregon Latino Health Coalition. We advance the health of Latinos through policy and advocacy and prevention. And today I speak not only on behalf of the Latino community, which now numbers over 600,000 Oregonians, but also for more than 100,000 individuals, immigrants from all over the world, including 13,000 children who rely on the Healthy Oregon program for their health and their well-being. HELP is a lifeline, as you've been hearing for our colleagues and testimonies today. It provides essential healthcare to Oregonians, regardless of their immigration status. This program reach is made possible by the 1,640 certified OHP assisters and 59 community-based organizations that provide this care in each county in our state. Their efforts ensure our neighbors can navigate a very complex health system, access preventative care, and feel safe seeking services when they need, and particularly when we are now seeing many of our immigrant communities being targeted by ICE. Today, we're united by a shared concern, the potential impact of the federal Medicaid changes being considered in the concurrent resolution budget. Any federal cuts would put our most vulnerable populations at extreme risk. We could see increased uncompensated care, reduced access to clinics and hospitals, and especially for families like in my community, my hometown in the Dalles, so the rural communities. Children and families may lose coverage or become too afraid to access care, leading to delayed treatment, poor health outcomes, and higher costs for everyone. The good news, the Oregon Health Authority budget, currently under consideration by our state legislature, recommends the full investment of the Healthy Oregon program. And as a community member, a first-generation immigrant and advocate, I am so grateful that I get to live in a state where our governor, legislators, peers, health system advocates have shown up for the immigrant community. So thank you. Now it is the time to reaffirm our commitment to equity and justice and the future of Oregon's diverse communities. Protecting HOP is not just a budgetary decision. It is a lifeline, and it's also the statement of our values and our vision for a healthier Oregon. So I want to thank you all for your leadership and partnership, and we hope to continue to safeguard these important programs for the health of our Oregonians.
Thanks, Olivia. You know, when I was seeing patients before, I had a lot of patients who were uninsured, and this program and creating coverage was life-changing to have accessible healthcare and, like you said, a very complex system. So thank you for sharing and being here with us today. Or Dr. Clausen.
I'm Logan Clausen. I'm a pediatrician and the CEO at COPA, Central Oregon Pediatric Associates. Thanks for doing this. Thanks for giving us a chance to elevate these voices. It really matters. Also a member of Oregon Medical Association, who's been here supporting. So for 50 years, COPA has been serving the families of Central Oregon. Today, we have a team of 29 pediatricians who cares for over 33,000 kids across 4 clinics. Just under half of these, we follow the statistic, are covered by Medicaid. They aren't just numbers. This is our neighbors, our schoolmates, and our community. That's why we're here. So the proposed cuts under HR 1 don't just threaten a line item in a budget. They threaten children and families. 1 in 3 kids in Oregon that depend on Medicaid for their healthcare. If these cuts go through, it means fewer well visits. It means missed vaccinations. It means delayed behavioral health screenings. It means complex care, chronic care conditions that are caught later. That means they're more dangerous and they are more expensive to treat. Additionally, the proposed work verifications and eligibility redetermination rules would lead eligible families to lose coverage. And I know you really wanted some specific voices, so I'm going to give some specific examples. So, for example, a 7-year-old boy in Madras who can't get an ADHD evaluation because mom missed a paperwork deadline due to unstable housing. Or a teen in Bend who can't get a referral for much needed mental health because dad lost Medicaid coverage during a job transition. So these are very key examples that we see now and only will increase in frequency if we see cuts, especially if we see those increased requirements around eligibility. Also, I think it's really important to point out different avenues that this funding affects, including how it's affecting how we spend money in healthcare. So now think about a 2-year-old. So she has an earache at 7 p.m. Mom gets home from work. 2-year-old is really fussy. Mom's really tired. The last thing that they want to do is go spend hours in the ER. At COPA, we are open every single evening until 8 p.m. on the weekdays. We're open every Saturday into Sunday. The only day we are closed is Christmas. That means we are there for that mom. We're there for that child. They don't have to go to urgent care or the ER. And she gets treated quickly, comfortably. She gets treated by a pediatric provider who knows her history, which means she gets personalized, high quality care, and she gets to go home and both of them get to sleep. If that is not just better, it's not just better care, it's less expensive. So just highlighting that these cuts, if they take effect, will eliminate many of these opportunities. So practices like ours, locally owned, independent, and deeply embedded in our communities, would be forced to make incredibly hard decisions just to survive if these Medicaid cuts are put in place. Reducing hours, limiting services, and cutting back access would be a reality. That same mom with a sick child at 7 p.m. might be left with no choice but ER or urgent care, which is much more expensive for the system, a poor use of resources, and a huge burden for the family. Independent practices like COPA consistently deliver the highest quality of care at the lowest total cost, but we're already under intense financial pressure, and cuts like that would tip the balance. Our dollars stay in the community. We hire local, we train local, we serve local, and every dollar invested in us flows back to the region. Medicaid is the foundation of that pediatric care. It's one that supports working families, rural communities, and children of every background. Undermining it will only increase costs and worsen outcomes. I think we invest in what works, we protect Medicaid, and we protect our kids.
Thank you, Dr. Clausen. I think it's really important, the two things that kind of came out was that administrative burden for families that are already struggling, and giving those real examples is real. Like there will be people that do not get coverage because they can't work through red tape.
Yeah, that are eligible.
Or
Yeah, they're that are eligible.
yes. And then just access. It's so fragile, and 50% of the babies are born under Medicaid. Like that access is essential. So thanks for putting those two. Dr. Lewis.
Thank you, Megan. Thanks for inviting me here, and thanks for being here to listen. So as I mentioned earlier, I live and work in Madras in Jefferson County, which has one of the lowest health outcome rates in the state currently by county. I came out of training in Klamath Falls, which was maybe at the bottom at the time, and then moved to Madras, and it's near the bottom currently as well. And so I've been working there for almost 11 years. I'm trying to improve those health outcomes, and over 50% of Jefferson County, right at 50%, is on Medicaid. As an OB care provider, the majority of my OB patients are also on Medicaid. I have a patient currently in labor today who travels to see me from Prineville. This is their third baby I will be delivering labor today, who receives funding not only for her OB care, but for 2 kids that I've delivered come and see me. They have all their sick and well child visits with me. And then all of her OB care has been under my careful watch. But she also was able to get dental care through Medicaid, which is another important thing to think about for these patients. There's limited options for who they can see for dental care to begin with, even though they do have that coverage, but during their OB care, it's really important for the health of the baby and the baby's future dental health, which also what Dr. Clausen said is accurate about how this increased costs, because we don't have that coverage, and then the kids have poor dental health. They're ending up in the ERs on antibiotics and all these things that could be avoidable. And this patient actually did get a dental infection while she's been pregnant this pregnancy, and had to come to me to get antibiotics because she couldn't get into a dentist. And if she wasn't pregnant and didn't have that dental care right now, she wouldn't have been able to get that help either. So that's another big impact. And I want to emphasize, to Olivia's point, like the diversity of Jefferson County also for me. We have a third Native American population in our county, and then a third of Latin origin, and then a third white or other living in our county who I'm helping care for in our community and for OB care. They travel, our patient population travels, including our OB patients, to get care in our facilities, sometimes up to 2 hours away. So I understand Sprague River was in Klamath. I went on a mobile clinic out there. And we're trying to provide that care out as far as like Fossil, Antelope, Mitchell. We go, like our patients come from Senatio up toward Mount Hood, all the way to deliver in our facility. And to have this funding cut and have them have to go even further to the nearest hospital would be absolutely devastating for birth outcomes in our state and prenatal care. So on that note, in the last 3 years, I started working with OHSU through grant funding to develop a residency program to build the workforce. So we're currently aiming to train 3 residents per year that want to go practice rural family medicine. So I've talked to Jeremy about this and how we can increase the teaching that we do east of the Cascades so that we get physicians training where they're going to practice. We know that residents will end up within 100 miles, 50% of them will end up within 100 miles where they trained. So my goal is to get folks that want to go out to Baker City, where Jeremy grew up, or out to LeGrand, John Day, Mitchell, to practice and try to alleviate some of these OB deserts that we're starting to have. And those OB deserts are just going to increase in addition to the food deserts that we already have. So that's what I want to emphasize, just that this need also impacts me being able to train the residents to go do this work. The majority of our patient population they're going to be training with is on Medicaid. And then the SNAP funding for pediatric population in our schools, all kids get free lunches at all the schools in Jefferson County because of this funding. And it's a huge need. We're going to have a huge hunger issue in our county without that funding. With our current food bank being overwhelmed and losing grant funding to expand recently. All of this ties into the care that I'm doing and and the stressors that my patients are going through and talk to me about that I already have very little control over. So I appreciate you being here, and I know it's a huge deal and it's a huge impact to all of us. Thank you.
Yeah, Dr. Lewis, thanks for bringing up the dental piece too. And I think your dental story is a great example of how investing in prevention saves major costs later. And dental is an example of that. And then your leadership around the Rural Track Residency Program is so important in rural communities because there is a shortage of primary care providers, and having these programs that we need to keep sustainability around are critical for the future of rural America. So thanks for being here today.
Thank you. Linda Selby, as I said, family doctor and CMO for the hospital in Harney. And, you know, rural hospitals, as I think most of you are around, are aware, Frontier Hospitals takes it even a step further. As he said, Frontier's, you said less than 6?
6 or fewer people.
Okay, we were at 0.7. So we have more square miles than we have people. And some of the challenges that really adds to on our hospital being the only hospital in the county, we are also the EMS. Imagine you're EMS and we struggle to have 2 crews. They're responsible for that whole area. That also impacts if we want to transfer somebody, you cannot take the only ambulance out of the county. So that's one of our struggles. Our current operating margin is a negative 4.8%. Our total margin is a negative 0.5%. We are bigger than 6 states. I loved and I kind of wish we only had 50% OB. I realize I'm afraid I exaggerated a little bit to Megan when I told her we had 90%. We just ran our numbers. We're only 88% of our OB patients are Medicaid. So I'm sorry that I exaggerated when I talked with you. Bad. Although we also get the mystery ones because we're pretty much the only thing between Boise and Bend. And people go into labor on the road too, from out of state, out of area, whatever. And so you just don't know what you're going to have there. And at best, we lose money with every delivery that comes in. We only have about 40 some, but we're more than 2 hours. We're 130 miles here where you are in Bend. This is the closest hospital with true OB services. Proposed cuts, we're going to have to consider at that hospital what has to be cut to ensure the viability of the hospital. We realize the critical importance, and I'm going to tell you about a couple of patients, but at some point, if you we're either going to lose OB or we're going to lose the whole hospital. And it may get to that point. Significant risk would be OB and the infusion program where people can get their chemo and their other needed infusions. We have been recruiting for a second OB for more than a year. Our model is 2 OBGYNs. They work 2 weeks on, 2 weeks off, 24/7. And last September, our second one retired. So now we're working hard. I would love to take one of yours. When they come right out of training, are they going to become from being the only OBGYN? So it does take a special one. And again, as I said, we're 2 hours from Bend. Many of our patients travel 2 hours to get to us. And then 2 hours further to get here. And there are major challenges, again, beyond that of a rural hospital. I don't know if everybody knows, but when a woman is in labor, do you want to transfer them? No. And air will not fly them. And there's plenty of times in the winter too, where you just can't go by ground or by air, even if we could. So with more cuts, we may not be able to maintain that service. Women and babies will die. In the not very distant past here, we had a 27-weeker. Mom came in, precipitous labor, tried to stop it, but within 30 minutes, she was complete. Thankfully, we have our OBGYN. We have 2 family docs who also do OB, although not surgical. We don't have enough to keep competencies up with that. We have an excellent RT whose background is with neonates. So thankfully, he was the one who was on call. And we do have 24/7 CRNA. Again, serving that whole area, we have to have these services, which are not cheap. They were able to stabilize both the mom and the baby and get them successfully to bend. 27 weeks, you're talking not even 3rd trimester yet. This is the edge of viability. So it is an amazing thing that they were able to do. And I was telling people, again, nothing against, I was 20 plus years in Prineville, and I was there when we stopped doing OB services. Even though you don't do OB, women still come in to deliver. And I had to deliver one, and I talked Bend into accepting another one, which thank God she abrupted when she hit the door there. But I just say that I know what it's like when you don't have it. You don't have the equipment, you don't have the staff. And this 27-weeker probably would not have survived if she had shown up in Prineville, just because they don't have the equipment and they don't have the trained staff anymore. Very recently, during a 7-week stretch, our one OBGYN was covering for us 24/7 for 7 weeks in a row. Had a 34-week mom, came in with bleeding, had to have a stat C-section. Again, if we had not had the OB, and he was not supposed to, we don't try to push him to work that much. He just feels such a responsibility, doesn't want the community to be without it. So he's like, no, I will just work straight through. And he did. Otherwise, we could have tried to push blood and cross our fingers and say a prayer for her and hope that, but likely again, in that case, both of them would have died. And that doesn't happen all that uncommonly. Right now, we have a 28-weeker that we're doing prenatal care where she has a complete previa, which means the placenta is over the cervix. So she's got to have a C-section. You don't want her to go into labor and the cervix start pulling away and bleeding out. And so that one is keeping our docs up at night already. So it's just such a vital service, but it's a hugely expensive, again, with only 40 some and 88% of Medicaid coverage. And then if I can have one more minute, can I bring up diabetes? Sure. The control of diabetics is a whole lot worse. Again, I moved 2 hours east. I thought I would have similar population. I do not. Again, we just ran our numbers here. 43% of our Medicaid population is uncontrolled. And when we talk uncontrolled, that's not a low barrier. It's not a tight control we're talking using our definition. Sean can tell you that. 31%. So you're 50% more likely to be uncontrolled. And I just shudder to think what the 56% that are controlled right now, what that would be without access to their medicine, to their testing supplies, to their doctor's visits. My brother died from diabetes at 45. So I push hard and I really try to work with him. And since I've been there for 2.5 years, every single week, I promise you, every single week and almost every single day, we have a patient on the floor for a diabetic wound, for an ulcer, for an amputation, for wound care after that. And again, I just see that going worse and worse. And even with what we have, it's not great. I would love to get the continuous glucose monitors on them. That can be a game changer, but they don't qualify. But please don't take away what we do have to be able to get the control that we have now. And just point out, if they lose it, they're going to stop coming in, they're going to stop testing, they're going to stop taking it. They'll still come into the hospital and they will cost more. And because of mandatory income requirements for charity care, we won't collect anything. And we'll take our small amount for Medicaid over nothing any day. They'll be in worse shape, we'll be in worse shape. Nobody's going to win from this.
Thank you for sharing, because I know how personal the diabetic journey is, and it is so true. When people do not have coverage, they ration their care. So they will not have their conditions, whether it's diabetes or other conditions, treated. And conditions like diabetes, you end up in the hospital with the complications. And then I also, or dead. And I also appreciate the frontier medicine. It is a different game, and you're already fragile. Like, you can't become more fragile, and we will lose services that are so essential, life-changing, life-needing in the community. So I really appreciate you being here today.
Thank you for asking me. Thank you for listening.
Well, thank you. I'm honored to be here and echo a lot of the sentiments that have been shared. And again, I want to thank Governor Kotek for holding such a timely roundtable. So again, my name is Jeremy Davis. I'm the president and CEO for Grand Hospital in LaGrande, Oregon. We have over 800 employees, almost 90 employee providers. We represent almost 5% of the workforce. There's a lot that keeps me up at night. I'm a father of 4. My oldest just graduated, so now I'm even more nervous. But I also care deeply about the community, and I care deeply about our physicians and our staff. Obviously, what's being contemplated in Washington, D.C. and the potential impacts to Medicaid through the reconciliation process are also keeping me up at night. Nearly half of the state's hospitals last year were in the red. So this isn't just rural, this is every hospital. So we're already on kind of unstable ground. And so further cuts to Medicaid obviously are going to put access to care and the economic stability of Oregon hospitals at risk. As many of the billboards show, 1 in 3 Oregonians are covered by Medicaid, covers 44% of the births, 3 in 5 children, 65% of nursing home residence days, and 37% of individuals with disabilities, which has been talked about. Specifically at Grand Ronde, so I asked the team, I said, look at our services that we offer, and can you tell me the top 5 services where Medicaid is the highest percentage of the payer? And I think you won't be surprised when I mention these 5. So number 1 is OB. Number 2, behavioral health. Number 3, pediatric primary care. Number 4, emergency department. And number 5, urgent care. So pretty essential basic services that every hospital and every community need to have for health and wellness. These aren't the lucrative or the fancy services, a lot of boutique services that people offer. These are just essential services. And if our hospital is like others in the state, they are probably very similar in terms of those being in their top 5. The health provisions in the budget reconciliation bill are aimed to achieve savings through decreasing enrollment and increasing the cost of the program to the state. So a huge cost shift. Let me be clear, this is going to impact us all. Not just hospitals, not doctors, not nurses, not frontline healthcare workers or clinics. This is going to impact every business and every industry in the state. So making it difficult for small businesses or manufacturers, other industries to recruit talent to the state. It's going to be very, very hard. And then obviously if passed, we expect the ranks of the uninsured is going to grow. And as we already talked about, these uninsured are going to delay healthcare services, and then they're going to show up in our ER. And then we're going to have to rely on the heroic efforts of our staff to do more work in the ER, likely uncompensated, that are going to put further pressures on the hospitals. Simply put, in my opinion, these cuts to Medicaid are going to impact lives and livelihoods across the state. Last year in Oregon, Oregonians visited hospital emergency departments more than 1.5 million times. This is a new record in the state. So I just shudder to think what's going to happen if these Medicaids go through. That number is going to continue to climb and climb. An interesting statistic that I came across, and it might be a little dated because I know that the Senate just recently released some new potential cuts that are going to make it even more. But this statistic said that saving $1 through Medicaid cuts could cost $5 in negative economic impacts in a rural community. I want to flip that narrative for a brief second. This almost is saying that for every dollar invested in a rural hospital or a rural healthcare provider, we're creating $5 of value. I think that shows the ingenuity and the creativity and the commitment and the dedication of our rural providers and frontier providers to take limited resources and do the absolute best and most that we can. And to have those resources cut undermines our ability to increase life expectancy and lower healthcare costs for not only Oregonians, but Americans across this country. So again, I'm grateful for the opportunity to be here, very timely, and I'm deeply concerned that further cuts are going to make it very hard for hospital administrators like myself to continue to offer the breadth and depth of services that we currently provide.
Yeah, thanks for being here and highlighting the breadth of the impact these cuts could have beyond the healthcare system and the rising uninsured population, which is what we've been working for the last 10 to 15 years to counter against. We've had that before, and it was very difficult and challenging and had all the consequences that your data is sharing, and we've moved beyond that. So we need to protect what we have. All right.
Okay.
Last but not least.
Again, thanks for the opportunity to be here, and thank you, Governor, for all the work you've done, the commitment to providing as much health insurance as we can in the state up to this point. So thank you very much. A lot of the same themes that I've heard, in some of my comments, but I want to talk a little bit about what a CCO means to members and communities. And at EOCCO, we're truly a hyper-local organization. And what I mean by that is we operate an 8-member payer-provider partnership. So some of our partners are those that provide care in Eastern Oregon, like Jeremy. We provide, since 2012, we provided care to underserved Eastern Oregon residents that is good, and I'd say sometimes often better than what you might get in other parts of the states, because you have to do, like Dr. Selby, she's got to do all kinds of different things, right? And Jeremy's providers have to do all kinds of different things, and others in the room here that you may not have in an urban area. You're doing more. And so sometimes I think that can be often better. Since our founding, and because of Oregon's CCO model, we've been able to reinvest significant savings we've generated back into the Eastern Oregon communities, truly becoming an economic engine for these local communities. I never thought that would be the case when we started the CCO model back in 2012. And just to give you an example, some of our investments range from enhancing payments to primary care providers who serve on the front line at delivering high quality healthcare, workforce investments. So we partner with our state and rural universities in the areas of things like community health worker and healthcare interpreter training and certification through a partnership with Oregon State University College of Health. Many of those folks that have gone through those programs are Oregon Health Plan members. And those are the people we want serving in these roles. Scholarships at Eastern Oregon University for students to earn behavioral health degrees, developing a pipeline for the next generation of behavioral health clinicians. They had their first course of 25 residents to get a master's certification. Many of those folks were from Eastern Oregon. Some of those were current Oregon Health Plan members. We've made tons of investments in social determinants of health with projects chosen by the local community. So we provide a Veggie RX program in nearly every county where residents can get prescriptions for healthy fruits and vegetables, and they'll get those filled at local markets. So obviously we're very concerned that the significant reductions in covered lives, which will result, I believe, in reductions in provider reimbursement. And those two things will have a significant impact on rural and frontier communities' ability to maintain services, or in worst cases, we've talked about potential closures of hospitals, which, knock on wood, we've all heard about rural hospitals closing across the country. That has not happened yet in Oregon, fingers crossed, but in part because of the CCO model having such an impact on these communities. So reductions in providers or services will have a direct impact on members. Quality of care, we talked about travel time that'll increase to be able to see providers. That'll have a negative impact on their health outcomes. And further, these types of reductions will have, as Jeremy said, a direct impact on local communities where hospital providers are routinely the largest employers in these communities. And all those reinvestments that I mentioned, my fear is those will have to go away, because we're going to have to use every dollar we have available to do the minimum, to take care of the members that we're going to end up having left to cover. Updates from the CCO perspective.
Sean, I'm really glad you're here to give that perspective, because the CCO model has been incredibly effective. And I love how you were able to call out how it gets phenotyped to the local community and tailored to the needs of the community. And that flexibility is unique in Medicaid programs. And so thanks for sharing that perspective. So I'm going to pass it to you for questions.
I want to say a few things to all of you and then see if there are any other final comments or other questions before we wrap up. But first of all, I'm honored to be here with you and hear your stories and hear what you are trying to do in communities and for your families. If anything, it just makes me more angry. So thanks a lot. So I was thinking as I was listening to everyone, we remember what it was like when we cut the Oregon Health Plan. Some of us have been around long enough that before we came up with the way to help pay for Oregon Health Plan in the state, which is the provider assessment, which is now being threatened by Congress to reduce the way that funding mechanism works for our states. When we cut the Oregon Health Plan, not we, but all of us globally during one of the recessions, this is prior to the Great Recession, we saw what happened. Families were hurt. Crime went up because people lost their care for behavioral health care, for example. We have police officers coming in. It's like, I'm seeing more people in need because they don't have health insurance. Like there was an immediate impact when the health plan was cut. Not to mention folks who were doing in-home care or nursing home care. Like people just got hurt, period, plain and simple. So we learned from that. Came up with provider assessment. The Fed said you could use this to help fund in a state federal partnership to pay for the health plan. And we did that. We have the best Medicaid program in the country, if you ask me. We know how to control costs. And I think what's really interesting is I don't know what they think in DC. This is not a luxurious program. We make it work, right? The rates should be higher. Money going to family providers should be higher, right? We're doing a lot with what we have, and this is just going to devastate that. There is no way to manage what is being considered without cutting benefits, without cutting access, without destroying our health systems. There's just no way around that. And I think it's really important the way you were all talking, how everyone is impacted. I think some people are like, well, I'm not on the Oregon Health Plan. Why should I care? Well, if we don't have the Oregon Health Plan for folks to pay providers, hospitals will close, services will be diminished. So you could have any kind of insurance you want or pay for it by cash, you will not have a provider. So we're all impacted by that. And every business, every industry is impacted because we're all integrated here. This piece around administrative burden, it's been interesting to watch at the national level. Its sole purpose is to decrease enrollment. That's how you get money. It's getting people off the program because you make it so hard to stay on. That's a problem. And I'm sure, I mean, you all know people, you know yourselves, that you are hardworking, contributing people to the state of Oregon. And this idea that you have to go through additional hoops to get basic care is cruel. And I think that's what we're hearing from DC right now. And as you've all noted, we already have healthcare deserts. Even despite how innovative and creative we are, we still have parts of the state that don't have care. And that is not going to get any better with the cuts that they are considering. And I wrote down that nobody is going to win from this quote. So thank you very much. No one wins from this. It's not about bureaucracy. This is not about a lazy, group of folks. This is not about a program that is so massively luxurious that we're all somehow all getting rich off of the Oregon Health Plan Medicaid program. That is not what we're doing. On the SNAP side, we will literally have people going hungry. That $28 benefit, unfortunately, it should be higher, but that is the federal program, right? That $28 is keeping that person fed. Yeah. The month, in addition to the food bank, in addition to all the things, right? So, and I could go on about SNAP, but so I really appreciate the stories. I thought the piece about EMS is really important. I think the idea that our healthcare system's like, am I going to have an ambulance in my community if we have these cuts? And it is about everybody. It is about every Oregonian getting the care they need, because we're all impacted when people don't have care. Can we touch just briefly about the administrative burden? We have tried to make it easier. We've tried to make it consistent. Like you're on, you stay on for a certain amount of time. What we're hearing is they want people to be on a much more regular basis, which we know people are going to fall through the cracks. Any things to share on the administrative burden side?
I think it's a game changer. I mean, I think it's from a clinic standpoint, not only does it affect people coming in, so like at the point of check-in when you're verifying insurance, to the people you have to employ to help people get back on or do the paperwork, to the back end of like the cycle from billing when they get kicked off and how frequently they get kicked off. So it not only like directly impacts sort of costs for clinics, but timeliness of care, because you have to perfectly plan, make sure that you can get the referral and get the kids seen before they have next cycle of when they have to turn in the paperwork. And when we changed eligibility so that you don't get kicked off as a young child, that was an absolute game changer. And it really meant that we could have solid continuity of care. You could stay with the same provider, you could follow through on all the services, you could get all the interventions you needed without these critical gaps. And before, over and over, when we didn't have that, we saw gaps, because as a busy working parent who has lots of other things going on, it's hard to get the paperwork in exactly on time. And the more hoops you put in, the bigger the gaps. And so we saw that, and I agree with you. We are in a great spot. That young age group of not kicking kids off every like 30 days was dramatically game changer for pediatrics.
And it does save money for the program. It's like.
Agree. And the amount of work it has to do to just check those boxes and follow all the rules, I think is, I'm not on that side, but I would imagine is substantially more than just keeping them on the program because they're eligible.
If the work requirements as proposed go through, it will take quite a while just to upgrade the system at the state to actually add that eligibility criteria. And I think we're talking, what did they say, 100 million plus?
Portion of the cost can range from 40 million to 100 million.
Just to set
Never
up
mind
the
the staffing, the hours, the deprioritization of existing projects such as the HR center waiver, some of the early learning initiatives that the legislature has funded.
We have to pivot to doing that. We don't do good stuff and it costs money, and then we just literally keep people up.
Yeah.
Can I add to that? So I think there's also going to be an added burden to communities of color, our immigrant community, non-English speakers, the elderly. You know, I help my parents on their Medicaid plan and I'm their translator. I, assist with the applications that are already kind of hard for them to fill out. So I think this work requirement is going to add a burden and disparity to those communities. Absolutely. Because of all the complexities that are going to be added.
Yeah, thank you for that.
The other thing is that we're seeing in the data that most Medicaid recipients are working underneath the work requirement. And so to add this extreme cost into a program that's already constrained, that we're making work as best we can in Oregon, is not where we want to be investing resources. It's not going to produce health outcomes or what we want for our communities.
You're either highly vulnerable and aren't able to work, or you're taking care of someone and already. And then if you're in the other category, you are working.
Yes.
So I don't know what we're trying to solve here.
And if you go down, I feel like the worst case, sometimes that's the way my brain works. Let's say worst case is that you keep people on that are eligible. We still can show that it will save the system money to do better, lower cost preventative care. So even if you are keeping on eligible people, we're actually still saving the system. Ineligible people, we're still saving the system money in the big picture. So I think this idea is challenging.
I could also see hospitals and clinics possibly having to hire more staff because we care to help our patients navigate the uncertainties of whether they have coverage or not. And so you're going to have to hire more case managers, community health workers, often at no additional reimbursement.
Right.
And do you want to resource that, or do you want to resource other care programs that help?
Or staff in ER,
Right.
Correct.
And if we get upstream, we can show over time that you lower healthcare costs through preventative healthcare.
We have managed through creativity and grit and the flexibility the federal government has provided states up to this point to run a cost-effective, humane Medicaid program in the state of Oregon. Is everything perfect? No. You're doing it well. And I have not heard one thing from certain members of our congressional delegation of how this will be better. It will not be better. There's no excuse for it. None. So I'm just looking.
Yes, I think we're.
Okay, yeah, you gotta cut me off.
We've been talking for quite a while. So again, thank you all for being here. Thank you for sharing stories. Thank you for sharing your perspectives. I think this was a really rich hour. And hopefully that gives you some additional information and stories and facts, and especially around rural Oregon. So thank you all, and we're going to conclude and move on to the next.
Thank you.
Thank you. You're welcome. Thank you.
Lucas, you're in.
Thank you.